name is Rebecca Pejak, and I'm a PhD student in public health. And today I'm going to be talking about some research in progress that I'm doing for my dissertation, which is air quality perception and improvement strategies in congregate living facilities. So, some background. According to climate.gov, 25% of all unhealthy ozone days were caused by wildfire smoke from 2018 to 2023 in the United States. Wildfires are a growing public health concern, especially in the Rocky Mountain areas, like here. One of the reasons why they're a public health concern is PM 2.5. I'm really glad that someone talked about this before I did, so I don't have to define it. But we know that increased PM 2.5 from wildfire smoke is bad for respiratory and cardiovascular health. PM 2.5 also affects both the indoor and the outdoor air quality. Vulnerable populations are more at risk of health effects, including adults over the age of 65. Now, if we think about congregate living, elderly adults in congregate living are particularly vulnerable. They don't have as much control over their environment, and they're likely inside for more than younger adults. Because of the vulnerability of this population, I wanted to do research about air quality in congregate living facilities. So first, I had to define congregate living facility. Congregate living is a housing model where individuals reside in shared spaces with communal facilities and services. So for this project, I wanted to focus on congregate living for vulnerable populations, specifically the elderly and pregnant people and children. So I did a hospitality care centers like the Ronald McDonald House, assisted living facilities, acute and long-term care skilled nursing facilities, and memory care units for older adults. First, I did an informal systematic review for my environmental epidemiology class last semester, and I looked at search terms indoor air quality, respiratory health outcomes, and congregate living facilities. And after searching through all of that research, there were only 5 relevant articles to review. This shows that there's little research about indoor air quality in these facilities. And the research that is out there is only in nursing home and long-term care facilities. There were no hospitality facilities like I mentioned. The studies that I looked at had mixed results. Some did find a health risk inside, and some did not. In addition, all the studies I found were outside of the United States. They were primarily in Brazil. The United States has very limited health-related air quality research in congregate living facilities. We have research about what the PM levels are in the nursing homes, but not about how that affects health. So, to fill that gap, I started a survey. It's a 15-minute survey with questions about feasibility, barriers to potential interventions, and employees' current perceptions about air quality. We sent the survey to congregate living facilities like the ones I listed on the previous slide, and we did a really wide net. Any facilities in Montana or Idaho are eligible because it's still going, and we also got a couple facilities in Colorado. The questions looked like this. How much of a health problem is poor air quality for the people living or working in your building? And then we asked them a couple more questions about their perception about the air quality. We also asked about potential interventions. So we showed them if you had an air quality dashboard, I use the word website because I got feedback that some people don't know what a dashboard is. Would you use it and would you find it helpful? And then we asked a couple more questions about that dashboard. We also asked about air filters. If you had one in your facility, would you use it regularly? And we asked about barriers. Why wouldn't you use it regularly? Do you think that your facility would encourage the use of these? I sent this out a week ago, and so far we have 38 responses. 43 now, I checked before I went up here. That's more than I was expecting because we all know people in congregate living facilities are very busy. So this actually turned out pretty well. We hope that this research will lay the groundwork for future research in congregate living facilities and give us insight to if an intervention in these facilities would be feasible or even wanted. We also hope that this will fill the gap in the research in the United States about health and air quality in congregate living facilities. Thank you.
Have data on that these facilities actually do monitor air quality? Do you have any way to identify, well, not in this study, but it would be interesting to know how those correlate with what they're observing about acute impacts on thinking processes, cognition, if air quality was a variable.
Yeah. Yeah. So the question was, we have research about this, and then it would be interesting to see how the actual air quality levels in nursing facilities relate to perceptions and cognition and how people think about it. I had Dr. Ethan Walker and Erica Fox on the title slide because they are also doing research in these facilities. Primarily, the research they've done is getting monitoring in the facilities, but we haven't done a lot on like actual health effects. So I feel like there's a lot of potential here to investigate stuff like that and the stuff that I'm looking at. Yeah.
Thanks for your interest in Montana Health Professionals for a Healthy Climate's annual conference. If you'd like to be kept up to date on monthly actions for climate and health in Montana, you can go to montanahphc.org/newsletters to sign up for our monthly newsletter or click the link in the description below. And don't forget to subscribe.